Welcome to part 4 of our discussion of searching and critical appraisal of evidence-based literature. Let's look at a variety of articles to see what types of things you want to look for when appraising them. So here we have a quantitative study. It's a randomized controlled trial called Maintaining Patency with Packed Red Blood Cell Infusions. And here's some questions we're going to look at. Is this a significant topic? Is the hypothesis clearly stated and focused? Who are the authors, and is the article peer-reviewed? Does the study design fit the research question? Who are the participants? Were they randomized? Were they blinded? How were the outcomes measured? And were there limitations that were spelled out? So let's take a look at this article. So here's our study, Maintaining Patency with Packed Red Blood Cell Infusions, comparison of IV normal saline infusion and normal saline syringe method. So let's scroll down and take a look at some of the aspects of this study. So you can see there's a literature review spelling out what databases were reviewed and what years and other limits were placed on that search. You can see that the authors of the study are spelled out. Many of them are nurses. There's PhDs, giving authority to the authors. If we continue on, we can see the objective of the study. The purpose and hypothesis is spelled out for this study. They're showing you the design and sample size, which is right up front, and that the study was reviewed by an institutional review board. Methodology for the study is explained, and the randomization of the subjects is explained as well. You can see they've put in here the data collection tool, which is great because perhaps it can be duplicated in another study by another researcher. And then they lay out some results here where they find no statistical difference between the two methods and tell you who completed the data, and then give you information in the discussion about the study, about any limitations that might have occurred, and the need for future research. So all in all, this is a pretty well laid out study. The references are current to the time period of the study and all spelled out. Next, we're going to look at a qualitative example, making sure registered nurses watching over their patients in the journal Nursing Research. So some questions we would ask in a qualitative study is there a clear goal? And why is the study important? How were the participants recruited? Was there a relationship between the researcher and participants? Is the research methodology appropriate? What data collection tool was used? Were there ethical issues? Was the data analysis rigorous? Could you read a clear statement of the findings? Is this research valuable, and does it add to our understanding of this topic? And could you transfer this research to your own setting? So let's take a look at this article. So here we are in our article in Nursing Research. First, we can see that there is a structured abstract with the background, objective, methodology, results, and conclusions all laid out right at the beginning with the author-supplied keywords. So oftentimes when you see a structured abstract, you can look right at that abstract before getting to the body of the article and see if a lot of the criteria you're looking for are met in that abstract. If you feel you need to go further, you can look at the rest of the sections of the article. We see here that Dr. Schmidt is a nurse and a professor at Loyola University, giving credibility to the author. The study research question is laid out. The methodology is generating a substantive theoretical model of the process used by registered nurses as they watch over their assigned patients during a single work shift is stated here. They use a classical grounded theory method, and the IRB for the institution approved this study. And they're telling you where their participants were recruited from. Now in this study, the participants were recruited through professional relationships between the investigator and the hospital officials. And the data was collected in a semi-structured interview style by person or by telephone. Also, the data was collected in interviews done by the PI and graduate students. Now the sample size here, you'll notice, is 15. That's a relatively small sample size. Usually you want to have larger sample sizes to give validity to the study. You can see the data collection and analysis and how long the interviews were held and that they were taped. And then what they did was they categorized different points. Or things that were said by the interviewees. So something like knowing what's going on was collected, being close, making sure. These are terms that would have been stated or concepts stated in the interview process and probably coded by the investigator. So those are spelled out throughout with explanations and more information. So they discuss the study and talk about the limitations that the study included. And then you can see that they denoted that further study of the theory needs to be conducted. And their references are listed here. Now some of their references are older. Could be that they're seminal to the points that were made in the paper. And the study was given some funding by an award. Okay, so that's our qualitative study. Let's move on to our next study. So our next example here is a systematic review. And if you remember through our discussion earlier, a systematic review is considered one of the highest level of evidence for a research article. So this review is from the Cochrane database of systematic reviews. Questions you might ask in a systematic review is the research question well focused? Is the literature search thorough? Does the study include important rigorous studies such as randomized controlled trials? Are the outcome measures expected? Is this a reproducible review? How did they report the results, and can you transfer this to your local population? So let's take a brief look at this study. So here's our Cochrane systematic review on short course antibiotics for acute otitis media. One thing about the Cochrane's systematic reviews is they're nicely laid out with a table of contents. There is a structured abstract, so you can look at the different sections of that abstract and pull out information from there, from the objectives to the search methodology and databases used, the selection criteria for the participants, and how they analyze the data. It'll even list out the main results of the study. You can see in this case 49 trials were looked at that had over 12,000 participants. So that's a very high sample size and lending a lot of credibility to the results. There's always a plain language summary in these Cochrane reviews and additional data that you can see here, oftentimes laid out in a table. If you look further into the study after you've looked at the preliminary information, you can go deeper into that information by looking deeper into the methodology used and the literature review and how that literature review was conducted, what terminology they used. They may use different databases than we have available, but you can apply a lot of the same information to the databases we have here at Regis. And it just gives a lot more detail throughout. Some of these reviews can be rather long. This one's over 70 pages. So you may want to consider that if you want to print it. You might just want to download it to your computer. But they're very detailed and give you a lot of great information. So you can always go to the Cochrane Library and pull up reviews by browsing on different subjects, or enter a few terms and look for reviews on your topic. So that includes our 4-part series on searching and critical appraisal of evidence-based literature. I thank you for listening in. And remember, at Regis Library, if you need help, always look for your librarian to help you out anytime you need it. Don't hesitate to call or email me, Kim O'Neill, or stop by the Research Help Desk and see any one of our great librarians here at the library. Thank you.